There we go. All right, good afternoon, everyone. Thank you so much for joining us today or joining the live stream. My name is Dr. Kyle-Ann Hunter. I am the CEO of Iraq and Afghanistan Veterans of America, known as IAVA. We are really excited to come together here today to announce the kickoff of the Modernizing of Veterans Healthcare project led by Iraq and Afghanistan Veterans of America under the leadership of Dr. David Shulkin, the 9th Secretary of the VA and IAVA board member. We are at a time right now where veterans healthcare is back in the news, often for not the best reasons, quite frankly. We hear a lot of scandal potentials that are out there. We hear a lot of negative stories, and the shutdown is, again, illuminating a lot of the challenges that veterans face. And this is not a project that is here to just point out problems. It is not here to rag on all the things that are wrong, but to convene medical experts, other members of the VSO community, to include generational aspects of the VSO communities, those focused on caregivers and families, those looking at particular communities, the medical community inside and outside of government, economics community looking at the costings that we need, and the academic rigor and research community that has been studying veterans issues for decades together to center comprehensive veterans healthcare reform right now. It is important to be looking at this right now where after 20 years of war in Iraq and Afghanistan, we also have a generation of veterans that look much different than the generation of veterans that the VA was designed for, or even the generation of veterans led by the wonderful work of the Vietnam Veterans of America, the last time there was real comprehensive reform. We see women joining the military and thus becoming veterans in numerous ranks, the fastest growing rank of veterans that we have. We see more ethnic diversity in our military. With the repeal of Don't Ask, Don't Tell, the military and veterans' families look different. And so we need to ensure that healthcare meets the needs of today's generation of veterans. Additionally, the way healthcare is delivered has changed astronomically since the last time there was comprehensive reform to the VA. Advancements in technology, advancements in telehealth, advancements in early and preventative screenings, all must be incorporated to ensure that veterans care remains the state-of-the-art care that we have in this country. And we recognize that right now there are lots of modernization efforts going on, that this is something that we are building off of, and that there have been great improvements to the VA system in the past decade. And so we are excited to offer an opportunity to bring the veteran community together, to bring them together with private industry, with academic excellence, and with the public institutions that are committed to serving our nation's heroes to offer comprehensive solutions. And with that, I am very excited to announce the chair of the board of IAVA, Wayne Smith.
Thank you, Guy. Thank you for being here today. It's really a pleasure to sit with you on what we think is a historic moment. My name is Wayne Smith. I was a combat medic in Vietnam, and I'm old enough to remember in 1975, not only is this the 50th anniversary of the end of that war, but that was also the time that began the recovery, the readjustment. And in 1975, a small group of Vietnam veterans joined with healthcare experts, members of Congress, citizens who similarly saw a need to change the way the VA had been providing health care. And it took 4 years, 4 anguishing years, I should tell you, before in 1979, the historic Vietnam Veteran Readjustment Act came into being. It created the Vet Center programs, it created Agent Orange programs, and so many other programs that were specific for my generation of veterans. But it is also true that some of the spillover, some of the outgrowth, some of what was learned from that legislative effort, and the cooperation of the VA, I should point out, to expand its programs continues to ripple across our nation. For example, almost everyone in America has heard the term PTSD, post-traumatic stress disorder. That began in 1979 with the leadership of the American Psychological Association that incorporated it. And its application wasn't just about war veterans' trauma, but how ordinary citizens, anyone, can be traumatized. And there are healthy ways to cope with it, to provide that kind of health care and assistance. So at this moment, we are overjoyed to, as a veteran, I must tell you this, if I may, because it's quite personal, but some of those founders of the Vietnam Veterans Movement are very dear friends, and we lost one just the other day, Bob Mulholland, who helped us to create that Vietnam Veteran Readjustment Act. So my generation is fast leaving the stage. And to paraphrase President Kennedy, I do tell you that the torch has been passed to a new generation. And I have the distinct pleasure and honor to serve as IAVA's chairman of the board of directors. It is a very dynamic board, some veterans, some non-veterans, but very serious about the undertakings of veterans' health care. We were part of the effort that helped to produce the suicide legislation. We have been very active in a number of areas that have made quantum leaps when it comes to helping post-9/11 veterans. And it isn't just Iraq and Afghanistan veterans. We are also mindful of those who currently are wearing the uniform. And under Dr. Shulkin's leadership and that of the Blue Ribbon Commission, this will be, as Dr. Hunter mentioned, this will be an open system. We have reached out to the other veteran service organizations, our sister and brother organizations. We've reached out to medical schools, healthcare experts, ordinary veterans, and we are committed to undertaking this noble effort to help to bring those on the political left and the political right together. And that is one thing that veterans have been able to do, is to bridge the gap. So we are committed to this effort. And thanks to good people like who have served on our board, the more than 475,000 post-9/11 veterans that are our members, they're counting on us, not just as the board, but counting on us as a population, as a nation, to respond to their needs. Many of you perhaps have been anguished, as I have, as we have concerns about the direction of healthcare in this country. And when I called Dr. David Shulkin, a distinguished member of our board, who has served our nation under 2 administrations, I called and asked if he would help lead this effort to bring some thoughtful, reasonable, but modern approaches to the healthcare system in the VA. He said, "Wayne, I've been waiting for someone to ask me." And this is the kind of response that we have been met with by everyone. So I am, again, just a small cog in this wheel. I am truly delighted to introduce and bring you Dr. David Shulkin, who will lead this effort for us. But make no mistake about it, this is an investment on the part of Iraq and Afghanistan Veterans of America, but we're counting on all Americans to help us to solve this common problem and to help our veterans truly come home. Thank you.
Thank you, Wayne. And now you know why it was hard to say no to Wayne. First of all, thank you all for being here. It's not like there's not a lot going on in the world, but the small but dedicated group of the media that tracks the veterans, and I'm looking at some of you in particular, your work is so appreciated. And what you bring by covering this important area and bringing it out to the rest of the country is really very much appreciated. So we thank you for your interest in being here. I also really do want to acknowledge IAVA. Wayne for the amount of money that we pay you, you do a pretty good job. You know, obviously the board is a volunteer effort, but Wayne has just done an amazing job of stepping into this and invigorating. And when you did call, I didn't immediately say yes. Maybe I did. Okay, okay, but I remember you saying, "Look, let's get on the board. Let's get on the call with the rest of the board and really make sure that this is what IAVA as an organization wants to do." And there was unanimous support. So thank you. I also, for those of you who haven't had a chance to meet Dr. Hunter Kai, she is our new CEO. And what an amazing leader and fresh breath in taking this organization to really where it can represent 475,000 veterans, and will continue to grow as each year 250,000 people become veterans. You know, so so thanks. But look, this is a serious time right now. VA has been a cornerstone of this country's commitment to our veterans and those who have served for decades and decades. But in this particular time, in what the country's dealing with, let's think about this. There are 1.75 million veterans who are on Medicaid. There are 267,000 veterans who rely on ACA subsidies. And we are going through a period in time in this country where, as you know, in January, those veterans are going to be facing a time with very different Medicaid eligibility requirements, potentially no ACA subsidies, and it is estimated that 200,000 veterans will likely become uninsured. Where are they going to go for their health insurance? The VA. And so the VA is going to become increasingly important to honor our commitment to our country's veterans. We know that close to 750,000 veterans in the last couple years have entered the VA healthcare system because of the PACT Act, because of the congressional additional benefits that have been earned by them, and now they can take advantage of that. And so the VA is so important, and yet, as Kai was saying, the healthcare system is changing unbelievably rapidly. Think about the technology, the new therapies that are coming on board, the use of artificial intelligence. If the VA itself doesn't modernize and change with the changing needs, it's going to become a system that's less competitive, and we don't want that. We really want the VA to be there for decades and to continue to really be that vital modern system. So as the former secretary of the VA, and almost every VA secretary that I know of will tell you, the voice of the veteran themselves is the most important voice. And so having a vocal community to be able to say, here are our needs, here's how this system needs to change, and by the way, we want to support you, but if you're not doing your job, we're also going to remind you of that. This is what this is about. This is the voice of the veteran community, and it's a big tent approach with other VSOs joining us to be able to help guide the VA to become that type of modern organization that we need it to be. And that really means best-in-class care, and that's what we're shooting for. So the way that we've started this, as a starting point that we've talked about, we've identified 7 priorities. I will tell you right now, we've already received feedback. Why aren't there 8, 9, and 10 priorities? And that means the process is working. People are saying, look, we understand what you're doing, but there are things that are important to the veteran community that need to be included. We welcome that. These 7 priorities are not meant to be an exclusive list, but one of them was to essentially have a big vision that the VA could become the first healthcare system in the country that is opioid-free in terms of pain management. Now, I've heard from veterans who are on opioids saying, this is horrible. You know, I need these to live. We're not talking about ripping away opioids from people that we've already been prescribing them to. We're talking about not starting new veterans on opioids, starting them with alternatives that are now available, FDA approved, as well as other modalities, multidisciplinary modalities, so we don't get people addicted to opioids in the future. We've talked as a second priority about toxic exposure. It's fantastic that we have the Heath Robinson PACT Act, and we know that's working. But when a veteran comes to a VA, they should feel that they're coming to a place for health care that is a center of excellence about toxic exposures. And while we have some dedicated centers of excellence in the VA, they're not meant to be scalable. They don't have the ability to see all the veterans who need their help, and they're not in every VA. So we want to try to help modernize that approach so that every veteran can feel that they've reached the right place when they come to the VA to evaluate their toxic exposures. Suicide prevention is a third priority. This has been a priority for a long time. We all know it. And the reason why we've highlighted this is because we're simply not making the progress that all of us want to see. It's not because of lack of effort. It's actually not because of lack of money. Congress has been very, very generous with their funds. The brain is complicated. This is a tough issue. And so we need to continue to keep that as a priority and to focus and figure out, are there new things out there that we can be looking at, whether it's the use of artificial intelligence as an additional modality or whether there are new approaches that we can help in trying to solve this really, really tough problem. The fourth priority is the transparency of data. The VA is a publicly funded organization. It belongs to the country. It belongs to our veterans. We believe that VA should be openly transparent about its progress and also about where it's not making as much progress or its barriers. And the VA has led in transparency. We want to make sure that they continue to do that and that they're committed to doing that in the future. The fifth area of priority is the community care network. We know that the Mission Act is law. We know that veterans need and want to be able to access care in the community, and we're certainly supportive of that. But we're concerned that there increasingly can become two standards of care, the care that's coordinated and integrated within the VA, and then when a veteran goes into the community, they lose some of those safety nets, and care can be fragmented, care can be lost in the community. And so as we've begun to transition and more veterans are going into the community, we think that VA needs to begin to modernize its approach to thinking about care coordination and data interoperability and making sure that the veteran is getting the same standard of care as they are in the VA healthcare system. The sixth of the seven priorities is payment reform. The payment systems in this country in the private sector of healthcare are changing rapidly. They're moving towards value-based payment systems. VA is just beginning on that approach. We think that's a good approach, but it needs to be make sure that it's staying up with what we're learning in the private sector. And then the coordination with the Medicare system, something called Medicare subvention, where veterans who are getting care and covered under Medicare, the VA is not necessarily getting that credit for that payment. And so we think from a taxpayer point of view, from the right amount of resources to be put into veterans' health care, that's something that needs to be looked at and frankly should be helpful to the Department of Veteran Affairs. And finally, we really believe that the VA should have centers of excellence approaches. That's part of a modern healthcare system that offers best-in-class care for all of the complex needs of the veteran. And the VA does this in an extraordinary way where it does it because it can integrate care where you integrate behavioral health with physical health, you integrate multidisciplinary teams. It's got the ability to take a look at data across different healthcare silos, and we really believe that's the right approach, and we want to see that done on scale and for the VA to have the support to be able to do that. So as I mentioned, that's not an inclusive list. We've heard from veterans already saying, well, what about military sexual trauma? Well, that's an important area, and by us not mentioning it in the beginning doesn't mean that that shouldn't be a priority. We've heard about the importance of caregivers and families, and we recognize these are really important things, that there are some great organizations that are doing work out there. We want them to be part of this, not to say that they're not important. So I'll just end by saying, as I think Wayne nicely did, what we see this as is as a blueprint for the future of the VA, the voice of the veteran in that blueprint, working collaboratively with Congress, with the executive branch, with the VA, but mostly with the veteran community, to be able to make sure that as this system moves, and to make sure it does move, that it really ends up being a system that not only meets the needs now, but meets the needs for the future generations of our veterans. And Lou, are we going to take questions if there are any?
Wow, fantastic.
Hi, Ellen Milheiser from Synopsys. One issue about modernizing and making possible the use of modern technology is the age of the VA facilities. Do you see yourself taking another bite and maybe suggesting something along the lines of the Air Commission, or do you see yourselves tackling infrastructure?
I could jump. The age and infrastructure is always a problem. Our approach is to first figure out sort of the what needs to get done, right? Like what actually needs to get done, what types of modern technologies are most focused, and then a next phase in looking at this is the how, right? And offering some of the blueprints for the how. Part of what we want to ensure is that we are not being overly prescriptive on the commission when it comes to particularly things like infrastructure. We are very clearly wanting to be independent, right? So we are not going to recommend, for example, particular vendors or particular types, right? But that, yes, as part of when we think about modernization, facility modernization is also a piece of it, right? Just as the demographics of the people have changed since the last time there was large comprehensive reform, the demographics of buildings, we should say, have changed along with it. So that is when we think about modernization, always a lens that we need to look through with.
And I'll just add something more personally, just from having sat in that chair. Commissions in Washington are really hard to get stuff done because, by definition, and you look at the Air Commission, certain amount appointed for Democrats, certain amount appointed for Republicans. It's like you almost know it's doomed from the beginning. So the VA actually recently has been doing a good job. They've been opening up more facilities. Congress has given them the ability to generate new leases, and they're opening up modern facilities. And when I speak to veterans who get to step foot in those facilities, they feel proud about being in them. They're glad that they're getting their care there. So this is, I believe, we don't need a new commission, personally. We need the VA to say, this is what we need, this is what we're going to do, this is how we're going to do it. But certainly when you've entered a VA facility, I'm thinking about Togus, Maine, no slight on Maine, but it was the first VA facility. I mean, that's an old place, right? So of course these need to be updated, and we need the modern facilities for the future. But I really think that the VA should make a decision about what it needs to do and suggest and ask for the authorization for that money. Congress is usually supportive. Let's not do a new commission.
Fantastic, thank you. I would like to add also to that, I am Lou Elliott Sosesky. I am the VP of External Affairs here at IAVA. And one thing that we want to do in this commission is to center around the voice of the veteran, right? Our role is a pseudo project manager in this action. Next question, please.
Yeah, so building off of that, what should we expect in terms of what we'll see out of this? I mean, you're envisioning, reports on this, or you're envisioning, summits on the, I mean, you talked a little bit about the collaboration with other organizations, but
Yes.
What's the public-facing part of this?
Yeah, I can answer that if you, okay. Both, all of the above, right? So we're starting by listening right now. We're taking in briefs, we're taking in suggestions, we're taking in opinions. We are looking for more subject matter experts to come in and be a part of this as well. We plan on holding convenings throughout the year as we build this. And this, right now, we're just starting this process, and we'll continue to evolve that.
Yeah, I'll jump in real quickly as well. So we are looking at there'll be a launch of a dedicated website and concept note to bring things in for the public. And as part of that as well, there will be a dashboard that will be transparent so that you can see where the progress is, and effectively looking at about quarterly releases of reports and progress updates. But we want to also very much ensure when we're looking at timing that we're being responsive to the realities of what is happening. If Congress is looking to move something forward, as Dr. Shulkin noted, if the VA comes forward and says, hey, Congress, we need you to do something here, or Congress says, hey, VA, you need to do something there, we may shift. But by Veterans Day, there will be a standalone page with a dashboard that shows continued progress, because transparency is essential for this.
Fantastic. Thank you. Any more questions? All right, we did get a few from on. Oh, okay, fantastic.
Hi, I'm Caroline Tucker with NBC. I'm just curious if you could address, you had mentioned in your remarks that it's estimated maybe 200,000 veterans could be going into the VA system. Wanted to know what you all think is going to be the impact of the reduction in staffing at the VA that's currently happening right now, and how that's going to impact that influx of veterans who are going to need VA care.
As you know, and if you're talking about the government shutdown right now, the VA gets its money in the 2-year advanced appropriation. So of all of the agencies, the VA is probably most protected in the executive branch. It has furloughed about 14,000 employees, and those 14,000 employees make a difference. So we very much want to see the government get open and be there to do its work. VA staffing levels are concerning in general. We've seen a lot of people exit the organization. Hiring has been slow. But that's something that I think, we're not necessarily going to be monitoring. That's not the role of what we're doing, monitoring the effectiveness of the VA right now. But we certainly know that in any healthcare organization, the single most important asset that an organization has is its workforce, and paying attention to having an adequate workforce that has a good morale, that is committed to its mission, is the single most important thing. So we certainly think that's part of having an effective, best-in-class organization. The thing that we're most concerned about is what's going to happen to those 200,000 veterans, and that if they lose their Medicaid eligibility, if they lose their ability to afford assurance because their ACA subsidies go away, that the VA has the capacity to take those 200,000 on. And that's something that we think the VA needs to be planning for.
All right, questions that came in from online as we opened this up. The first question was, is this privatization by another name?
The short answer is no. This is a project, as both Dr. Shulkin and Wayne have mentioned, that is about ensuring the VA is prepared to meet the newest generation of veterans. That said, we will work with folks in the private sector because, as Dr. Shulkin noted, community care is a reality. Yes. And we need to ensure, though, that remains veteran-centered and coordinated, and that there is many standards of care, but this is definitely not a privatization effort.
Thank you. Next question is, how much will this cost?
There is no cost to the taxpayer for this at all. This is a initiative that is led and funded by IVA.
Exactly. Next question is, what is actually broken?
Well, I think we've identified already some areas in these 7 priorities that deserve to have improvement, and the obvious one that I mentioned was the veteran suicide, with 17 veterans a day taking their lives. And so that would be one example, but we think that the payment system needs to be updated. We think that there are, the further that VA gets from where the private sector hospitals and healthcare system is modernizing, it puts the VA at risk for future generations. So continuing to see at every at every facet of the healthcare organization that there are people out there saying, are we meeting the needs of veterans? Are we modernizing fast enough? Are we making the right and smart type of investments for taxpayers? That's where VA needs to be focused, and we are not here to criticize them. We're here to give a veteran's voice to that effort.
Fantastic, thank you. Is this political?
Wayne, from my position on the IAVA board, I don't think we've ever had a vote of who's a Republican or a Democrat. We don't have those discussions. We are trying to represent the members that we have in a way that is non-political.
Fantastic. Are there any other questions out there? No? Well, we do welcome anyone who is a subject matter expertise to reach out to me. I have business cards in the back. Otherwise, my email address is lou@iava.org. And feel free to reach out to me, send me any information that you have, any questions you have, and I'll be happy to answer them.
Thank you for coming.
Thank you.